Welcome to the long COVID advent calendar. I can't even remember what day we're on, but we're really moving through this. And today I want you to answer this question. Is your diaphragm stuck? And probably you're sitting there going, I've got no idea. I've got no idea what my diaphragm's doing most of the time, because I don't think we do. But I can tell you in the classes that I'm teaching for long COVID breathing, I am coming across a lot of people with long COVID whose diaphragms are stuck. And it really means that trying to do breathing exercises with these nasal breathing inhales and exhales becomes a little bit difficult. And actually, people with long COVID and stuck diaphragms is actually very common. And the reason is that our diaphragm actually regulates our mood and emotion. It sounds weird, but it's true. So we've had these emotions of sadness, anger, anxiety, fear, and that causes our diaphragms to get stuck. And then what happens when our diaphragms get stuck is they don't return to the resting position. And then we are forced to breathe with our upper chest. We go into that hyperventilation. We've all done it. I know I was one of those people. And the other things that go along with your diaphragm breathing, the slow breathing, the longer exhale, become very difficult. So we want to try to unstick our diaphragm. So what I'm actually talking about, I'll do a demonstration with my bicep. So if I did a bicep curl with a weight and all I did was that movement, yes, my bicep would grow, but that's not the range of motion I'm trying to get. The range of motion that's needed for a full bicep muscle is that. So take that example, put it on your diaphragm. We inhale, our diaphragm goes down. We exhale, our diaphragm returns, but it can't return to its normal resting position. So part of that muscle doesn't get used. And then we have these issues. So how can we unstick our diaphragm? So once again, this is not medical advice. If you don't feel great, don't try this. But what I would like you to do is I'm going to invite you just to lie down on the ground. And you're just going to do some normal inhales and exhales through your nose. And when you feel comfortable with that, what I want you to do is do a normal inhale. And then you're going to exhale through your nose. And when you feel like you've finished your exhale, you're going to continue to exhale. So you're going to push your stomach in. You're going to pull your belly button into your spine. And you're going to empty your lungs. You're going to keep exhaling until you can't exhale anymore. And then you're going to inhale. Now, one of the things I don't want you to do is I don't want you to force your breath. So it should be a normal inhale and then a nice smooth exhale, but then you just keep exhaling through your nose and then just do a normal inhale again. And think about what's going on. As you inhale, your diaphragm goes down. When you exhale, so you're exhaling and you're inviting that diaphragm to come up, up, up and return to that position that it wants to sit in. So try that. Don't do many repetitions. We are all compromised, some more than others. So when you do this, maybe take 10 minutes to do some nice diaphragmatic breathing. So remember, we breathe into our diaphragm. And maybe in 10 minutes, you do 3 or 4 repetitions with some rest in between. But don't force your breath. Try to imagine what's going on. revisit it when you're feeling well, but please don't push yourself too hard. It is a great exercise, but it needs to be done with caution.